All right, check this out. It's called flexible robotic surgery. It allows surgeons access to areas previously unreachable without an open incision. And St. Louis University Hospital is the first in this region to offer this system. And we've got SLUCare's Dr. Greg Ward. He uses it. He specializes in head and neck microvascular reconstructive surgical procedures to restore and basically restore form and function affected by cancer. Doc, thanks so much for coming in.
Yeah, thank you for having me.
I think we should really begin with what was before this new technology and show people, because then they'll have a better appreciation for this.
So some of the things that I do are in the back of the throat, beyond where you could reach with some other just line of sight if I just looked in someone's mouth. And so the original thing developed, more than a century ago is to use what's called a laryngoscope, and that allows you to work through a channel, but anywhere that you can reach straight through.
Just a straight line.
Exactly. Yeah. And so you can get a camera through here, you can use a microscope, but everything is based off line of sight.
Wow.
And so then people developed a robotic technology that followed the same sort of idea, which is still line of sight. But then this new Flex system that we now have and is installed, it allows us to work by going around the back of the tongue and down into near the voice box and the throat.
And this thing actually curves and moves?
It does. It articulates and is able to drive this camera, which is like a high-definition 3D camera. So I operate with 3D glasses on, so I can see as if I'm seeing you, and then drive my instruments through these flexible ports, all through basically the same area that the original technology uses to get to the back of the throat.
We've talked in the past about robotic Da Vinci method, where the doctor is not even on the premise, but you are there for the surgery using this.
That's correct.
And how long have you been doing this at SLU Hospital?
We just installed this technology last month, and so this is brand new to the region. And this is a fantastic opportunity for our patients, because there are some cases where we might be able to avoid invasive incisions, longer hospital stays, or things like that.
How many surgical procedures have you performed so far?
First is next week.
Oh my gosh, well this is fantastic. And
yes.
So how do you prepare for something like this?
So a lot of what we do is, in working with the company, we do cadaver lab and, kind of review and practice and use models and things like that, so that, when I walk in there, I'm prepared for that patient.
You are enthused with this, I can tell. I mean, this is a game changer.
I really feel the main benefit to this is, I'm a beneficiary of minimally invasive technology. I had an appendectomy laparoscopically.
Oh, really?
Almost 10 years ago.
Okay.
I walked out of the hospital the next morning.
That is fantastic.
And so this, to me, is the next evolution, is using our own natural openings to avoid incisions and get people out of the hospital faster. Yeah. And if I can offer that to even a few patients, then I feel like we've won.
Are you still active duty in the Army Reserve Medical Corps?
I am in the Army Reserve. I drill on the weekends once a month. Yes, sir.
Maybe this will be coming to that too. It's just...
the Army does have some great things about technology, and certainly SSM Health has brought this for us.
It is the first to have this. That is, we appreciate you coming in today and sharing that with us.
Thank you very much.
Also wanted to mention that be sure to watch Fox 2 News tonight at 9 p.m. for more information in the SSM Health Medical Minute. Always something new going on here in St. Louis. We're going to go back to Randy.
All right, thank you so much.